Hello, PennDOT Community Traffic Safety Partners. Thank you so much for joining us for another video which is being produced for you by the Children's Hospital of Philadelphia Center for Injury Research and Prevention. In this video, Chapter 8B, we'll conclude our conversation about program adaptation and talk with you about what the process looks like, breaking it down for you step by step and providing you with a checklist and considerations for this process. We'll also present you with 2 worksheets, which we think will be very helpful for you as you go through the adaptation process on your own. The adaptation process starts by assessing our audience and community needs. You can learn more about conducting a community needs assessment with stakeholders by watching chapters 2 and 3. The next step is to review programs that are already out there and judge them for their feasibility, taking into account any theories that they used, their core components, and then ultimately with our stakeholders determining a feasible program. You can learn more about this process by watching Chapter 6. We next involve our stakeholders to help us define the extent of adaptation needed and to develop an implementation and evaluation plan. We'll then develop and test mock-up versions of our materials, which we can modify or revise based on our stakeholder feedback. Once we have those modifications and revisions, we'll implement the program with our stakeholders, evaluate the program, and disseminate our results. Now that's an overall snapshot of the process. Let's break that down a little bit further. So the first step in adaptation is to assess our audience needs and the community environment along with our stakeholders so that we can be sure going forward we're very clear about the objectives for our community, what our community deems as important, and how feasible it is for us to meet those needs. The next step would be to identify a program which we feel would be helpful to adapt. Optimally, we're hoping this is an evidence-based program, and to review the original research about the program so that we can fully understand its design and its implementation. After that, we'll want to review the program with the stakeholders and get their feedback on how appropriate it is to then adapt it for this particular community. That will help us to define the extent of our adaptation for the objectives, methods, and materials that are available to us. And if needed, will let us know whether or not we need to work with health education specialists or perhaps other experts who can ensure that when we run our adapted program, we're doing it in a way that maintains fidelity. Recall from our previous chapter that when we're talking about program fidelity, we're referring to how closely our adapted program aligns with the original program. The closer our program aligns with the original program, the more likely we are to see a replication of these kinds of successful results that we see in evidence-based programs. The more changes we make, the less likely we are to be ensured of those replicable results. So sometimes that means that we have to work with specialists who can help us to ensure our fidelity. The next step would be to develop mock-up versions of our adapted program or product so that we can identify what changes still need to be made and so that we can test our revised materials with our audience before going out into the field. We'll then want to pilot test our adaptation with representatives from our audience, not our entire audience. Because remember, especially when working with limited resources, we want to make sure that our program can be tried and true for our audience before we take it out to the entire field. We'll then modify or revise our program and our products based on that pilot feedback, implement our program, evaluate its effectiveness. We can learn more about that by watching section 3. And ultimately, after evaluating it for its effectiveness, we hope that you'll also disseminate the results so that others can learn from your program. Key questions to ask yourself when you're considering adapting is what will be involved in implementation and how long will it take? How will you know that it's being implemented as you intended? Will you have the same results as the original research? Why or why not? What needs to be evaluated? Do you need a process, impact, or outcome evaluation? You can learn more about the different types of evaluation in Chapter 10. And ultimately, how will this be done? Again, the entire Section 3, Chapters 9 through 13, will have a lot of details for you on program evaluation. But ultimately with these questions, what you're asking yourself is, how much time do we have to do this? How can we do this? How can we ensure that we're doing this in a way that's in line with the way the program was originally intended? And how are we going to evaluate ourselves to make sure that we did it in that way and met our goals? We've provided you with worksheets, which we think will be very helpful for you as you go through this process. Please use these worksheets, which can be found in your resource book, to help you choose and adapt community interventions. You can also use this worksheet as a checklist to help you determine the overall strengths and weaknesses of programs that you're considering adapting. Consider, for example, whether the program meets the criteria for SMART goals and concepts and objectives, whether it's appropriate for your audience in terms of age, developmentally, whether it matches the personnel resources that you have available to you, for example. You can also use this checklist to determine the overall level of rigor in a research-tested intervention, because we hope that you're going to be considering evidence-based interventions for your work. Determine whether this program that you're evaluating is research-tested, practice-tested, or simply an emerging program that you think that you want to adapt and grow. Ultimately, we hope that you're going to make a lot of use out of our Teen Traffic Safety Program database. The Teen Traffic Safety Program database is being provided to you to review a number of programs across the nation, which we think are really a good start for you to consider for adaptation. The database includes tons of information, including but not limited to the program type, creator, and sponsor, the format for the program, and who serves as the instructor for the program if there is one, program goals, costs, and the frequency of sessions for the program, the level of implementation, evaluation, and dissemination. This also provides you with links to program materials when they're available, as well as key contacts for your follow-up, because it's possible that you'll find a program that you're very interested in adapting in the Teen Traffic Safety Program database, but you need more information. By providing you with key contacts, you're able to follow up with the people who ran the program so that you can ask them your questions and adapt it for your use. This concludes the section on selecting and adapting programs and interventions. In the next section of our guidebook, section 3, we'll talk about program evaluation so that you can understand and learn the tools so that once you start to develop your own program or to adapt your own program, you can assess whether it's working, what needs to change, and how you can shape your program as you go forward. Thank you so much for watching.